Thank you, Madam Chair. You know, when you look at the name of the committee, Health, Education, Labor, and Pension, my feeling, those first two, health and education, for most American families, your well-being physically has got to be of great concern, and then how you're edified through education would be there probably as number two. We should all probably be in agreement, in sync there. And I think the journey that we're on is how you do it sustainably and what part of government should weigh in most on it, or how you hold the private sector accountable to do its share as well. Briefly on health care, it's the driver of our structural deficits. High cost of health care across the system within a broken industry that operates more like an unregulated utility than it does a business that I know works, where you have competition, you have full transparency, you play by the rules that make American enterprise work. So I think we're straddling a very tricky spot to where we're asking government to do more when it hasn't necessarily knocked things out of the park, especially in healthcare. On the other hand, we've got to hold an industry accountable that, in my opinion, drives most of what ails us budget-wise, not to mention what we're currently contending with, where we're asking an institution to do even more, and we're probably going to pay for it mostly on the back of future generations by borrowing a lot of it. I just think we are on a unique committee that probably is involved with the things most dear to most American families, and I'd say that we need to take a more responsible approach to not overburden a federal government that is already doing things and not paying for it. On the other hand, not to let a broken institution like healthcare that doesn't operate in the true realm of competition and transparency. Education has many of those same parallels. I looked at what Mitch Daniels in Indiana has done, where he's run that in a way that's made it more entrepreneurial, more businesslike. The rest of our institutions across the country, where we suffer with most of the high cost of education that has now eclipsed that of annual rates of increase over healthcare, what a notorious kind of place to be. We need to look at things a little differently, and if it's using the same approaches and paradigm, I think we're going to be disappointing the American public down the road. Thank you, Madam Chair.
Thank you.
Madam Chair.